Syringe. The nurse used a sterile syringe to administer the flu vaccine safely. X-ray. The doctor reviewed the X-ray to check for broken bones or fractures. X-ray machine. The technician operated the X-ray machine to scan the patient's chest area. Inhaler. She reached for her inhaler during an asthma attack at the park. Injury. His leg injury required immediate medical attention and a full rehabilitation program. Crutches. After the surgery, he used crutches to walk without putting pressure. Doctor. The doctor examined the patient thoroughly before making a final diagnosis decision. Wheelchair. He moved around the hospital using a wheelchair after the spinal injury. Braces. Dental braces corrected her teeth alignment and improved her confident smile. Scale. The nurse checked the patient's weight using a digital medical scale. Blood. The lab analyzed a blood sample to check for any underlying disease. Scalpel. The surgeon carefully made an incision using a sharp, sterilized surgical scalpel. Eye drops. She applied soothing eye drops to relieve her dry, irritated eyes. Trolley. Medical staff pushed the equipment trolley quickly through the emergency room doors. Medicine. He takes his heart medicine daily to manage blood pressure and cholesterol. Operating table. The patient was prepped and transferred onto the sterile operating table immediately. Bandages. The nurse wrapped clean bandages around the wound to stop the bleeding. Test tube. The blood sample was placed into a labeled test tube for lab analysis. Plaster. She covered the small cut with a colorful cartoon plaster from the kit. Stethoscope. The doctor placed the stethoscope to listen to the child's heartbeat clearly. Gauze. Gauze pads were used to stop the bleeding from the deep cut. Tweezer. The nurse used tweezers to remove the glass shard from the wound. Tissue. She offered him a tissue to wipe his nose during the consultation. Surgery. He underwent surgery to remove the tumor from his lower abdomen safely. Walking stick. The elderly man leaned on a walking stick for better mobility support. Pipette. In the lab, she used a pipette to transfer precise liquid measurements accurately. Mortuary. The mortuary received the body for post-mortem examination and official documentation. Measuring jug. The nurse used a measuring jug to prepare an exact medicine dosage. Blood pressure. The doctor checked his blood pressure regularly during every medical appointment. Surgical mask. Everyone wore a surgical mask to prevent infection during the pandemic outbreak. Remedy. She found a natural remedy that helped relieve her seasonal allergy symptoms. Adhesive tape. The nurse secured the gauze with adhesive tape to keep it stable. Medical gloves. Doctors must wear medical gloves during every procedure to ensure hygiene. Capsule. He swallowed the antibiotic capsule with water after his morning breakfast routine. Cotton wool. She dabbed cotton wool with alcohol to disinfect the injection area. First aid kit. A well-stocked first aid kit is essential during travel and emergencies. Microscope. The scientists studied the bacteria sample under a high-powered microscope in lab. Antiseptic. Antiseptic was applied immediately to clean the wound and prevent infection spread. Thermometer. The digital thermometer beeped when it finished reading the child's temperature. Syrup. She gave her son cough syrup before bedtime to ease his throat. Oxygen mask. The patient wore an oxygen mask to help with his breathing problem. Tablets. The pharmacist instructed her on when and how to take her tablets. Medical scissors. The nurse used medical scissors to cut the bandage cleanly and quickly. Antibiotic. The doctor prescribed an antibiotic to treat the bacterial infection immediately. Fire extinguisher. A fire extinguisher is mandatory in all hospital rooms for safety compliance. Disease. The disease spread rapidly, prompting health officials to declare a medical emergency. Nurse. The nurse calmly reassured the patient while monitoring vital signs and administering treatment. Ambulance. The ambulance arrived within minutes to transport the injured man to hospital. Sick. She felt sick all morning and finally went to see a doctor. Patient. The patient waited patiently for the test results from the pathology department. Blood sample. The technician drew a blood sample to test for infections or conditions. Prescription. He handed the prescription to the pharmacist to collect his medication. Health. Good health requires regular exercise, a balanced diet, and mental well-being. Ward. She was admitted to the general ward for post-surgical care and observation. ICU. The critically ill patient was transferred to ICU for constant medical supervision. Emergency. The emergency room staff responded quickly to the multi-vehicle accident victims. Doctor's office. She sat nervously in the doctor's office, awaiting her diagnosis results. Medical record. The hospital updated his medical record after every treatment and test. MRI. The neurologist ordered an MRI to investigate the cause of seizures further. CT scan. A CT scan was performed to check for internal bleeding or damage. Ultrasound. The technician performed an ultrasound to monitor the baby's development inside womb. Radiologist. The radiologist interpreted the scan images to assist in accurate diagnosis. Anesthesia. Anesthesia was administered before surgery to ensure the patient felt no pain.